So I told you a little while ago that there was a chart that I wanted to be able to show you. There was a good chart that would show risk as it is in where you are now. And that they should be able to put that together because they had the data at the CDC page, but they just didn't put it all together. Where by county they put recent cases, so you can see what is going on now, not just the total since the beginning of this outbreak. So you can know where is the risk now, divided by the number of people in the county, so that it really did show it was comparing, like I'd say, apples to apples, rather than just it looking like a really heavily populated county has all the cases. And they finally, I say they, it was a group of researchers that put this together. So this is what this map is. So it takes a little while to load, but here it is now. And it looks like it's still doing some loading. But so this shows at a county level where the most cases are occurring. And in fact, as expected, Arizona, Florida, number one, number two. And I say as expected because just that's what we've been seeing in the news. That's where the most cases are occurring right now. As a state, as a whole, they're considered the red spots, the highest risk, where the most controls should be in place to prevent this. Now, you can focus on particular parts like this. I'll click on Arizona, and then it zooms me in, and if I want to open that up, I can look at the specific counties in Arizona, and so I see that my county, Maricopa County, as far as risk level, is the fourth highest risk right now, current risk in Arizona based on recent cases. So to me that's useful because then I can get a good picture on what the risk is like specifically where I am. Now, if you live in a yellow zone, or especially if you live in a green zone, you may think, oh good, we're okay. The problem is we have to be careful not to think that way. I'm going to take these off because of that funky glare. Um, we have to be careful not to think that way. So weeks ago, we were here in Arizona, and I started to hear people say, and you know, I work at work. I try to help. That's my job. I'm an occupational medicine physician. I help employers and their employees to try to accept or understand risks related to work. And in this case, one of the major risks is COVID-19. So using my public health skills to try to help employers have safe workspaces. And so that's been like, this has been my life for a while. Um, One of the things we were talking about early on was how, you know, we do these different activities to try to flatten the curve, right? That was one thing that's talked about a lot, is flatten the curve. And the problem was, after a few weeks, when we heard about all this bad stuff happening in New York, and we got, you know, a couple of cases among people we knew in Arizona, but overall it was like, okay, looks like we're doing okay. And you look at the graph and it looks like, yeah, that curve was flattened. And we thought, okay, this is good, we did it. That was the problem. I started to hear people say, we flattened the curve, right? And the problem is, no, 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 no. It's not we flattened the curve. It is we are flattening the curve. And that's the thing, is we have to be committed to those things that work, that we're working. That's, for a while, we were doing that in Arizona. We were flattening the curve. But then people got comfortable with it, started to go back, open up things. People started to go back out and get back to their regular routine. It's not necessarily that awful to open a few things up again, as long as we maintain physical distance, use facial coverings, and still try to minimize to what extent we can going out and things of that nature. So as long as we do that, then we'll be able to keep things for the most part under control. Uh, so we need to think of it that way. We got to keep doing this. Now, I know for some people they think, how long can we do that? And I hear some people that essentially seem to think, well, isn't this just going to happen to us all anyway? And when you flatten the curve, it's just about leveling it out, so it just doesn't all happen at once. Well, while there's a little bit of truth to that, there are a lot of things we can do if we flatten that curve. We could come up with better cures. Just recently, we did find a drug that works really well, lowered the case fatality rate by a third, and not a new drug. It's a drug that we expected might be able to help because sometimes we use it in lung conditions. And so there are ways that we may find good ways to treat this. We may be able to develop a vaccine in record time. Things are looking relatively good so far, but that's still a ways away. Um, we may actually be able to get it under control. The way it is in the US right now, that will be extremely difficult because it has just been running so rampant in some places. But there are countries in the world where they have been able to do that. And some of that is because they may be a smaller country, maybe a more simple economy, or a more simple immigration, travel, crossing around with the world kind of thing. To some degree, that may be true, that our situation is more challenging and more difficult. But that doesn't mean we can't do it. We have great resources, and we have incredibly smart people here. Um, there, we should be able to do this, but it's going to be hard and it's going to take a while. But the way that you do it is you test people and you trace them and you quarantine people. You can get it under control that way. You absolutely can. There are countries that have done this. And we haven't had a strategy to just really hammer down and do that. We can. And so that's a possibility that we really could if we focus. And like I said, there are a lot of areas that are green and yellow now. If those areas stay vigilant and have those resources in place, have those structures in place to do that, then they may be able to keep it that way. But you can't just say, oh, now we're going to go back to normal. It's going to take some time. It's going to take some time. But we can get through this. We can keep it in control. We can find better cures, and we can avoid people showing up on the that death graph, that death curve. If it keeps spreading, it will kill people. We had over 48,000 new cases reported today. It took 2 months to get to the first 48,000 cases. Today, we had 48,000 cases. We can get it back down. Many countries have done it. If we do it, then we need to maintain that focus and keep it under control. And if we do that, like I said, we can get so many more of us through this. Some of us will get it. Yes, some of us will get it. And most of us will recover. And that, in a sense, there's some good to that. But it's not like, well, let's just let everybody get it. We'll be killing people if we do that. We will be killing people. And if we can be patient and stretch it out and hold on, then we will save lives. We will find better ways to treat it. And we will all be better in the long run for it. We're going to be better people, a better society, if we do it that way. So that was the message that I kind of shared with the family. And like I said, my son was like, oh, I need you to record that and so I can put it on my Instagram or whatever. That's the message. Keep on keeping on. We can do this and we can save lives. It's challenging, but it's not that complicated. That's the key. We know what to do. We just need to stick together and do it. This is Dr. Andy trying to teach you public health to make this world a better place. That's what I like to do. All right.